Greetings, everyone. Welcome to this pre-recorded interview for the Southeast Asia Regional Session. I am Birger Stamperdahl, the president of Give to Asia, a public charity in San Francisco that supports advised grant-making to local organizations across Asia. And I am grateful today to be sitting here virtually with Dr. Rahmat, the executive director of Yayasan Project Hope in Indonesia. He's based in Jakarta. In an article during the first week of August, CNN described Indonesia as now being at the epicenter of the world's COVID pandemic. It is the world's fourth most populated country, and just in the past month, 1.2 million new COVID cases have been reported in Indonesia. Dr. Rahmat is a medical doctor and an epidemiologist. He has extensive experience in health sector programming and in managing humanitarian assistance to natural and man-made disasters. Dr. Rahmat has worked on behalf of major development partners like the World Bank, the European Union, USAID, the International Committee of the Red Cross, and others. He is now the executive director of Yayasan Project Hope in Indonesia, which is a not-for-profit foundation that is the extension of the International Project Hope NGO. I'll also note that Yayasan Project Hope is a grant recipient of Give to Asia, and most recently has received support of COVID-19 programming in the past 14 to 16 months. So thank you, Dr. Rahmat, for joining us and for joining me for this interview. So to give some people background on Project Hope, could you just please share a little bit about the organization's mission?
Yeah, we envision a world where everyone has access to the health that they need to reach full potential of their life through a strong and resilient global community of healthcare workers. Our mission is to put the power at the end of local health workers to save lives across the globe.
I was planning on asking you some questions about the work of your organization specifically as sort of a case study of what's happening in Indonesia, and then asking you some broader questions about how you see the nonprofit sector generally in Indonesia that might extend to the situation in other countries. So I guess to look specifically at Project Hope, first of all, where does Project Hope get its funding, and how much of its funding right now is overseas funding?
Yeah, we actually raising fund locally in Indonesia, in particular during emergency response, like assistance for victims of earthquake and tsunami in Central Sulawesi region. But 80% of our funding for health sector programming for development actually comes from overseas donors.
Thank you. So when the pandemic started, first of all, how did it affect your team? How is your staff and the organization affected directly by the pandemic?
You know that everybody was not prepared for a pandemic, including us. Some of our field officers that working in government building contracted by the virus, while also other health workers also infected by the virus, that they share the room with them. They have to be in self-quarantine, working from home, and the government travel restriction also limit us to our beneficiary. We have to change our modality from direct to direct meeting into virtual meeting for conducting training, etc. But we have to maintain quality and expected impact to the target audience. So we understand that the demand for care are even increasing during pandemic, but we have to apply new way of working according to the government health protocol.
And so how did you decide what projects or how to prioritize the needs during the pandemic, to sort of match your organization's skills or access to have an impact?
Actually, we struck with the number and percentage of healthcare workers that contracted by the virus. Some of them died by the virus, for example. Up to now, more than 1,500 healthcare workers died because of the virus. We also learned that pregnant women and children also infected, and we suspect that the COVID-19 transmission may happen within the health facility. So meaning that we have to protect healthcare workers, but also we have to protect mother, children from getting infected by the virus. So we change our approach that we need to identify what actually the need at the health facility, and we understand that most of the health facility have insufficient personal protective equipment, and our baseline assessment so that the healthcare worker knowledge and practice on the correct use of personal protective equipment is very low. The practice on donning, doping PPE is low at 55%, and the hygiene practice also less than 60% score. With this, we also need to help the local government to protect both healthcare worker and the clients.
You mentioned one of the projects that we were involved with, which was called Train the Trainers, and that was a project that helped to train healthcare professionals to keep themselves and their communities protected during the pandemic. Dr. Rahmat, could you talk a little bit about the impact of that project and how many healthcare workers you reached, etc.?
We apply a cascade approach for delivering messages to our target beneficiary. At the national level, we train about 115 master trainer on infection prevention control program. And through a combination of on-site and virtual training, through doctor-to-doctor online webinar, we can expand to reach about 39,000 of health workers with basic knowledge on infection prevention control. We can reach more healthcare workers through the trainers projects.
Can you maybe give us a sense of what the cost of that project was to deliver, and how many dollars did it cost for each healthcare worker that you were training, just to give a sense of the kind of impact donors can have with a project like that in Southeast Asia?
We implement $150,000 grant for saving healthcare workers, and we can reach 39,000 healthcare workers with basic infection prevention control knowledge, meaning that for $4.5 we can have one healthcare worker receiving basic infection prevention control knowledge.
Okay.
And from other projects, we also learn from saving life grant. If we invest $3, we could make a pregnant woman screened or tested for COVID-19.
Well, we know that the US dollar can go a long way and have a big impact in Southeast Asia for projects like these. And it sort of gets us, I think, talking about your perspective more on the nonprofit sector in general in Southeast Asia and in Indonesia. And so for a donor who is interested in making maybe the biggest impact they could make in Indonesia right now, where do you suggest they start looking, or what are the biggest funding needs just generally in Indonesia that you see right now?
We learned that from a statistic, the COVID-19 second wave, so declining number of people getting infected and die because of the COVID-19, but the second wave is not over. We learned that the outbreak actually moving from the urban to peripheral location, to the peripheral district to Java Island. We can understand that the provision of oxygen concentrator, for example, could make a difference to make the hospital at the poor district to be self-sufficiency to provide oxygen when demanded by the patient that need oxygen supplies. Yeah. In addition to that, we learned that more and more pregnant women and newborn are contracted and infected by the virus and even died because of the virus. And some of them have no access to emergency room at hospital when hospitals are overwhelmed with the COVID-19 patient. So I think provision of COVID-19 screening to pregnant women, supplying with personal protective equipment, or help the health facility to be more ready when mother and baby in need of emergency also necessary.
So for a donor who's evaluating different nonprofits and the work that they do in Indonesia. We know that there's a fairly healthy nonprofit sector in Indonesia, as there is in quite a number of Southeast Asian countries. Do you have any advice on how they should sort of evaluate or what they should look for when they're considering a nonprofit to work with?
Yeah, from the quantity perspective, donor need to monitor how many workers, how many pregnant women, how many facility are reached and supported by the invested grant. But also we need to monitor the quality of the program. What is the quality of the outcome? For example, we need to measure the improved practice on hand hygiene after the healthcare worker receiving infection prevention control training. Also, when we donate oxygen concentrator, we need to also rate how many people serve and utilize the donated machine and how many lives can be saved by donating oxygen concentrator in a hospital. This is not easy measurement, but we need to monitor this. And the third, I think we need also to measure the sustainability of the activity. In our program, for example, we try hard to insert our program into the system since the launch of the program. We need to build the connection of the infection prevention control program within the existing hospital accreditation system so that they can sustain after the project finish.
Great. Well, thank you, Dr. Rahmat. I think maybe one last question here, which maybe ends on a fundraising note for you. What are initiatives are Project Hope currently raising funds for? What are the additional sort of projects that you have planned for the rest of this year?
At the moment, we are raising donation for oxygen concentrator. We plan to distribute to hundreds of hospitals in periphery area that hardly hit by the pandemic to build the resiliency when they have to treat a patient with COVID-19 and needing oxygen supply. In addition, also we would like to expand our reach of saving life of healthcare workers. We want to expand our infection prevention control program to additional hundreds of hospitals in rural district with the potential for distributing also personal protective equipment. And we would also continue to insert mental health program inside the hospital team so that the mental health program could sustain within the supported hospital. And struck by increasing number of maternal and neonatal deaths directly or indirectly impacted by the COVID-19, we need to combine the infection prevention and control program within our existing saving life activity. That's our current plan.
Well, thank you, Dr. Rahmat, for the discussion today. I think it's really helpful for donors to just hear the perspectives and activities of people and groups that are doing the work in the country and in Southeast Asia right now that's being so impacted by the pandemic. So I greatly appreciate you taking this time, step away from your work and speak with me. And best of luck to you and Yayasan Project Hope.
Thank you very much for giving opportunity to talk with you, to be interviewed and to raise the awareness of the current situation in Southeast Asia and in particular in Indonesia situation. Thank you very much.
Thank you.